Dental implants fail all the time, or at least that's what I hear online. Why do they fail? And is that even true? I'm Dr. Paola Noni, and today I'm going to answer those questions for you by telling you the top 5 reasons why dental implants fail. First reason is lack of proper care at home. Once implants go in, it's important to maintain really good hygiene at home. Uh, Otherwise, when you come back in, we see a lot of inflammation in the gums, and any level of inflammations can oftentimes lead to the implants themselves not integrating. The second reason is systemic conditions. Uh, I one time had a patient who, at the time of surgery, her A1C level was great, maybe a 7.4. We went through with the surgery, and unfortunately, her diabetes really was mishandled during the healing period. So when she came back in 4 months later, we noticed that her implants had failed, even though implants have less than a 1% failure rate. So it got me curious. We tested her A1C, and it was at 12.4. That's incredibly high for an HbA1c level. Apparently, she just stopped taking her metformin. That's not something that we would advise against. If you do have some sort of systemic condition, it does not mean that you can't get dental implants, but it does mean that you have to make sure to take special precautions and follow treatment through with your primary healthcare provider and keep us in the loop so we can keep you healthy and give the implants the best chance to integrate possible. Coming in at number 3 is smoking. Smoking is definitely something that we need immediate cessation of. We need to stop smoking right when we get those implants in. Over the course of a 4 to 6 months period, your body is creating new bone that actually grows into the dental implants and locks them in. So by the end of that time period, they're a part of you. In the very initial stages, when you are experiencing postoperative inflammation and you have the stitches in and everything, any kind of negative pressure in the mouth is going to compromise that site. I did have a patient who came in and had one implant fail right in the midline. He was smoking the entire time. He told us that he didn't think he needed to stop. And unfortunately for him, he found out that his assumption was incorrect. Luckily, we were able to salvage the case. He did get healthier. He did stop smoking. But that initial healing period is really important, and you have to let your body be able to do its work so that you can have a successful long-term outcome. The next reason that implants might fail is implant overload. So like I mentioned, over that 4-month period, 4 to 6 months, your body is creating that new bone. Essentially, you have bone buildup cells and bone breakdown cells, osteoblasts and osteoclasts. Right after surgery, the osteoclast or breakdown cells are in higher concentration and you're undergoing an inflammatory process. So they're remodeling the bone around the implants. In that 4 to 6 months period, the blasts or cell builders end up becoming in higher concentration. So they're creating that new bone that grows into the porous titanium of the implants. That process happens cell by cell, and it is a delicate process. So the last thing we want to do is start chewing on things that require a lot of force or adding stress or rotational forces to the implants. That is going to interfere with that process, and it's going to cause it to just not integrate. And the last thing is poor planning or an inexperienced surgeon. There is a very big difference between getting an individual implant or getting a full mouth worth of implants. An individual implant, although it also requires proper planning in order for it to integrate properly and give you good long-term success, is just one single point. The full mouth treatment of implants takes a lot more coordination, not just from the surgeon, but a surgeon working closely together with their restorative doctor to make sure that, okay, the surgery was done properly. The implants have been placed where the bone is the most stable. And also, my restorative doctor is going to be creating the teeth to actually fit over those implants properly and distribute the forces of the bite properly so we don't overload the implants. That's the key to success. And that's why here at Nuvia, we have such a good success with this because our surgeons and our restorative providers are working hand in hand in the same office, seeing the same patient at the same time. So yes, the good news is that if you do your research and you find the provider that is right for you, you're greatly going to reduce the chance of failure. Once you start taking care of your end of things, like home care and not overloading the implants and taking care of your health, and your provider takes care of their end of things, planning the surgery properly, planning the bite properly, making sure the prosthetics fit you well and fit your bite well, that's a recipe for success. I chose to work here at Nuvia for many reasons. We're able to give our patients their permanent teeth the next day in just 24 hours. Being able to change someone's life like that overnight, basically the snap of your fingers, it's very unique, and it's not something that you find in many other fields. We take so much pride in our work, and we've really built a reputation on providing really lasting, high-quality restorations that completely change people's lives. And Nuvia's cost transparency is one of the reasons that we're top-rated in the industry. So grab your free cost guide in the description and compare, see what's best for you. Until next time, stay smiling, stay healthy.